we can do a lot of incredible things treating cancer and heart disease, but foundationally and fundamentally, many of those are dietary, exercise, lifestyle things that contribute to that overall health. And so I think if you look at what the US spends on healthcare and the social determinants, it's similar to other countries, but other countries spend a lot more on the social determinants and less on healthcare. And so I think if we, as a country, as a culture, can start to think about the things that we do that make us unhealthy, and then the reverse things that we can do to make us more healthy, that has a whole lot more return on the investment. Okay. We still need to invest, and the US still leads in the development of healthcare, and that will never go away. But if we can get people talking about exercise and diet and the things that we eat and the things that we do or don't do for our health and for exercise, I think that's a great conversation. I think that some of the concerns that I hear is, certainly we've heard about vaccines, we've heard about um, fluoride in the water. So there's some things that I do worry about, because sometimes when politicians, leaders talk about things in the theoretical or abstract, or we need to have more data, sometimes that translates into people thinking that's now fact and they can make important decisions based on that. And I
Yeah.
think that I think the health system, the public health system, the medical community, I think that we need to be cautious and also humble enough to say these are things that we know that are good, and these are the things that are bad that we know. And there's a lot of things in the middle that we're just not quite sure about. And being cautious and overreacting either way to those. And so that's what I think about, not just him as an individual, but the public health system, the preventative healthcare system, the sort of global health system that we think about.
Yeah, I mean, I think in premise, the initiative is good. I think it's going to be a lot about the execution, to your
Yeah.
point. So I think how that gets executed, and from a concrete perspective, what actually are the outcomes that we're looking for. Again, theoretically, it sounds very good.